sleep is such a crucial aspect of our biology. There's a reason why evolutionarily we have dedicated almost 1/3 of our lives to sleep. Matt Walker has spoken about this. QQRT is the 4 pillars of good sleep.
Quality, quantity,
Regularity, timing.
people who are night shift workers, where sleep is a huge problem.
I think there are many problems with not getting adequate nighttime sleep. Just because you sleep 7 or 8 hours, it's not just the duration of sleep, it's the quality of your sleep.
What is happening in your practice in terms of social drinking?
Who wants to know what alcohol is doing to you, get a bio tracker and see what the effect of alcohol is on your sleep. You will be amazed how disruptive even one glass of wine can disrupt your sleep.
In your practice, sitting is the new smoking. How common is that?
Tremendously. Every week I get so many young people, they're constantly suffering from neck and back pain.
Welcome to another episode of our podcast series, Gut Feeling with Dr. Pal. Today, we are interviewing a brilliant neurosurgeon from Bangalore. His name is Dr. Arvind Bhateja. In this podcast, we talked about the complications of hypertension. If you or any of your family member is dealing with hypertension or high blood pressure, taking hypertensive medications, this is an absolutely important podcast to listen, because we talked about the complications of hypertension. What will happen if your blood pressure is not controlled? What is the number that you should look at? And if the complication happens, what are all the treatment options? And in case if a person is developing a stroke-like symptom, what is that early symptom that everybody should look for? And especially the critical time period that a patient should be admitted to the hospital. We talked a lot about all this. It was a wonderful episode. I'm sure you will enjoy and learn a lot, similar to how I did.
Because in the last couple of months, I've seen so many patients who have undiagnosed hypertension, and their first symptom of high blood pressure is a hemorrhagic stroke.
Oh my God.
It is devastating, right? That you don't even know that you're suffering from high blood pressure. And people tend to think that blood pressure is not a serious problem.
Educators in terms of the numbers that patients should look for hypertension maintenance.
So obviously, in my opinion, anything above 140/90 is a...
Should we measure blood pressure like every month?
I think you should measure it every opportunity you get.
Do you remember what was the presenting sign for that patient?
He just fell unconscious.
Unconscious.
Suddenly.
Suddenly.
So again, that suddenness is what alerts us to the possibility of a stroke. There is something called a stroke-ready hospital and a stroke-certified hospital.
I see. I didn't know the difference. Tell me, what's the difference?
The stroke-ready hospital is where they can do big...
What are the small things that can be done to prevent hypertension to start with?
Exercise is a non-negotiable part of your treatment. There is no way you can escape it.
It's time to prioritize your health now. I think it's the bottom line. Hi, Dr. Arvind, or Doc AB. Welcome to the show. And I'm so happy to have you. I'm just going to jump right into the topic of very dear and near and dear to my heart about stroke. So I'm going to tell you a scenario which I recently faced in US. So I live in California. A friend of mine who's right next door, he had a baby. And so as usual, we call it a US custom, where when a baby is born, the first 6 months will be taken care by the wife's mom, wife's parents. The next 6 months, dad's parents will come. So we alternate this. Okay. If you don't know, this is a trick that we do.
I didn't know that actually.
Most of us we do. So during that, I got a call around like 9 a.m. that the 60-year-old dad is not able to lift his arm. Okay. So I was like, something is wrong, because he had hypertension, he had diabetes. So I ran up to his place and I could see his face was deviating to the right hand side. Then I said, this looks like a stroke and we really need to take him to the emergency room right away. When did this start? It started at 6 a.m. When he woke up in the morning, he looked up the mirror and he saw the deviation of the mouth and he could not lift his toothbrush. And they thought that it was jet lag. And that's why it was. So we missed those critical hours. And then by the time we went there, it was a bleed in the brain because of hypertension, elevated blood pressure. So, as a neurosurgeon, I know that you deal with this on a daily basis because you are the one who are going to save them.
Hopefully.
Open the brain, evacuate the blood clot and everything. I really want to know what is happening here in India in terms of the stroke volume and the prevalence and the awareness about how early should we come to the hospital, especially because the hypertension and diabetes, all the risk factors are being on the rise,
Yes.
being more prevalent. So what is your take on that?
First of all, let me thank you for inviting me to your show.
It's my
It's
pleasure.
such a pleasure to be on the show of a fellow medical practitioner who's so popular on social media.
Thank you.
And I really, I love the way you enunciate your ideas and your sense of humor.
Oh, thank you, sir. Thank
Something I wish I could do more of when I talk on social media, because I think I'm not funny enough.
you. You just didn't know.
Yeah, stroke is definitely a very serious problem in this country. I think we don't have good statistics because this is, again, India, the data unfortunately is not complete. But in our clinical practice and from colleagues, we hear that the stroke incidence is very high these days. Of course, like you mentioned, the risk factors for stroke, diabetes, high blood pressure, poorly controlled lipids, obesity, inactivity, smoking. These are all the common risk factors for stroke. Now, you specifically mentioned about hemorrhagic stroke. So there are essentially, a stroke is something that people should realize is a sudden onset, something which happens very suddenly. So when we talk about diseases in the nervous system, we talk about something called the temporal profile, means the way the disease evolves over time. So if you were to take something like a tumor in the brain or the spinal cord, tumors are growing at a predictable rate, like slowly. So these are progressive diseases which happen over several weeks or months. Whereas stroke is something which happens immediately, very quickly, few seconds to minutes.
Right away.
So that itself, that pattern itself identifies the fact that the patient may be suffering from a stroke. So that's a clue. So if you see someone who suddenly developed a weakness or an abnormality, it's most likely something to do with the vascular supply to the brain, means the blood supply to the brain or the spinal cord.
So whenever there is decreased blood supply to the brain, stroke can happen.
Correct.
So there are two kinds of stroke.
Exactly.
One is decreased blood supply to the brain because of a clot that is supplying the blood vessel. So it's like a plumbing pipe and there is a clip. Second is when the vessel itself ruptures.
Yes.
Like a hole in the pipe.
Yes.
So the blood leaks through the pipe, gets accumulated outside in the brain parenchyma, right? Brain tissue.
Correct.
And because of that, the blood supply is not going into the brain.
It's not so much because of that. What happens is in an ischemic stroke, so there are two types, ischemic and hemorrhagic. Ischemic stroke is there is a blockage of the blood vessel that's supplying the brain, like you mentioned.
Correct.
So the clot is inside the blood vessel. And therefore, beyond that clot, there is no blood flow. So there's an area of the brain which is not receiving enough blood supply and oxygen. And as you know, the brain is a very oxygen, glucose hungry organ. Is the hungriest organ in the body. It needs constant supply of glucose and oxygen. So the moment it gets interrupted, brain cells start to die. And unless that is reversed quickly, there is irreversible death of brain cells.
We are talking about in seconds.
In seconds to minutes. Usually they say it's about 3 minutes is the cutoff.
3 minutes.
And in hemorrhagic stroke, what happens is that the blood vessel bursts. And this is a catastrophic rupture of the blood vessel, which happens again over a few seconds. But that blood which leaks out, it actually damages the nerves
surrounding
it. And that pressure of the blood causes again a reduction in blood flow around it. And the fact that the blood itself leaks out into the brain matter damages certain neurons. And that is what causes loss of function. So if you were to look at it from an aspect of prognosis or improvement, ischemic stroke generally has a better prognosis. Because if you are able to restore blood flow, and sometimes the body's own mechanisms, clot busting, plasminogen and all that, those themselves can restore blood flow. We see this commonly in what is called embolic infarcts, which come from the heart. So you may have issue in the heart like atrial fibrillation or a blood clot that's sitting in the heart which can go to the brain. And usually embolic strokes, they recanalize very quickly.
So let me just rephrase that. So for my understanding as well, so where atrial fibrillation is where the heart is not pumping properly.
Correct.
So that's a rhythm problem.
Yes.
So because of the rhythm problem, the blood gets clotted in the heart.
Yes.
And the heart has a blood vessel that supplies from the heart to the brain.
Yes.
And because there is a clot in the heart and because of this irregular beat, the clot in the heart can go up and block the brain.
Correct.
That's called the embolic stroke.
Embolic stroke. So stroke, clot which is coming from some other part, not from the brain. So we typically call that embolism.
Embolic stroke.
In medicine.
So the prognosis is, if our body is right, with the normal defense mechanisms, it can recanalize, which means the clot can be disintegrated just with our body functions as
correct. So in the body, we have a system that causes clotting because clotting is protective, right? You don't want to, if you cut yourself, your body has to stop the bleeding. At the same time, the clot has to be dissolved also at some point. So that system, which is the clot busting system in the body, also tries to get activated. In embolic stroke, it's usually successful most of the times. But in ischemic stroke, it depending again on the size of the clot, it may not be very successful. So when it is successful, you will have a patient who presents with a reversible ischemia, which is what we call a TIA or a transient ischemic attack.
So what means that if a patient had a sudden onset, but they'll be completely normal right after.
Yeah, within a few, maybe
within a few minutes or hours.
Yeah.
I saw a patient like that.
Yes. That's called a TIA or a transient ischemic attack. That's usually a harbinger of a stroke. So that means if you had a transient ischemic attack, you should be going and getting yourself checked to make sure that you don't have any blockages anywhere because this can recur.
Correct.
And it also increases your risk of developing a major stroke.
I'll tell you a clinical situation I was in. I was in my native village called Karaikudi, which is next to Madurai, my native city.
Right.
So it was a huge function. Of course, there were lots of food in the morning and breakfast. After the breakfast, my uncle actually passed out of the bed. Well, like 30 minutes to an hour. And I was right there. And within 30, I would say like 5-10 minutes, it was pulse. There was so the people thought that it was hypoglycemia because of he had uncontrolled diabetes. Then I said that there's no way possible because we just had a good heavy breakfast. So I said that you need to go and check this. Either it could be a heart similar to the clot that you're talking about, or it could be something going on the brain. So he had the exact same thing what you said. Irregular heartbeat because of that stagnant blood clot.
Yes.
And then it threw up a clot, and luckily it was a small clot at that time. So, wow, beautiful. This is fascinating. So, while we are talking about this, coming back to my patient.
Yes.
So, that patient had his 60-year-old deviated mouth. So, that is a sign of a stroke.
Yes.
So, there is an acronym that we use in US. It's called F.A.S.T. I'm pretty sure it's a pretty common field in your neurosurgical field as well. So, F.A.S.T is F is face. A.S.T. Why don't you explain to our audience?
Face, arm, speech, time.
Super.
So if the face is deviated, again, very crucial is the time duration over which it evolves. The arm patient is not able to elevate the arm. Speech gets affected. Usually that means the dominant hemisphere is getting affected. So where the language functions are localized. So most people, the language is localized on the left hemisphere. So if speech is affected, either the person is unable to say anything or is not able to understand what you are saying to them. So it's both receptive speech as well as expressive speech. Both can be affected or one of them can be affected.
The tricky thing is they're not able to understand, but they're talking something incoherent.
Yes. So if you ask them a question, again, not by signaling using sign language or by writing it down, but by saying, if they're not able to understand the spoken word, they will give you irrelevant answers. So if you ask them, what's your name? He'll say it's Thursday or something like that. He or she.
Wow. So that's how I talk to my wife though.
T is time. So the reason why we bring time into the equation is because we say time is brain.
Yes.
So the faster you reach a stroke-ready hospital, which can diagnose you, image you, and begin treatment, because nowadays we have very effective treatment for strokes, particularly if the patient reaches the hospital within 3 hours. So
Yes, I remember. 3 hours is a golden period.
3 hours is very important because that's when most of the intravenous medications can be given. So there's a window period when in the first 3 hours after stroke, we can, provided it's an ischemic stroke and not a hemorrhagic stroke, and if the CT scan or the MRI does not show any bleed, then we can administer these injections very safely. There are certain criteria, but once those criteria are met, we can administer these injections and the outcomes are much better because, like I said, neurons start dying within 3 minutes. But around that focus or the center of the stroke, there is what we call a penumbra. So if you were to look at a solar eclipse, for example, you would see a black spot and then you would see a penumbra. That penumbra in a stroke is area of the brain that is getting blood supply, but not enough to function. So when we give these clot busting medications, those areas can be saved. And that improves the outcome. Otherwise, those areas will eventually also succumb.
And that will lead to more neurological damage.
Exactly. The larger the area of stroke or that area of damage, the worse the clinical outcome of the patient.
So talking about that intravenous medications, that is the medication that is going to disintegrate that clot.
Yes.
Break open the clot so that the blood supply can be restored.
Yes.
And that has to happen within 3 hours, provided all the criteria are met.
Apart from that, if the patient reaches the hospital later, there are still other things that we can do. So we can intervene by doing catheter angiography. We can do what is called mechanical thrombectomy. So using some retrieval devices from inside the blood vessel, we can retrieve the clot.
Wow.
We can use medications to bust the clot. We can stent vessels to open up blocked vessels.
That's fascinating, isn't it?
Yeah, it's amazing. In some cases, it's totally life-changing for the patient. Totally life-changing.
So explain to us about it. From a layman term, I'm asking. So angiography is you put a small catheter inside your groin
Either
area.
in the radial artery
or in the groin area.
Yeah.
So you track all the way into your heart and then you go to the brain where the actual clot is.
Yes.
And then you're able to actually remove the clot through a device. Wow.
Yeah. So the good thing about, I think, in the last few years, neurosurgery, neurology, neuroimaging has advanced so much. It's mind-boggling to even see that in my lifetime, very short career span of 20 odd years in neurosurgery, things have evolved amazingly.
Wow.
So today with an MRI, we can study virtually everything in the brain, right to the point where we can do a perfusion map of the brain within seconds. So we can tell which part of the brain is receiving how many ml of blood. So you get a map, it's called a CBF map, cerebral blood flow map, or MR perfusion map. You can tell blood flow, blood volume, transit time of an RBC across a particular pixel.
Wow.
You can actually study the blood vessels of the neck and the brain non-invasively using MR angiography.
Oh my God.
So even
all these are good tools to measure around the stroke.
Yes,
area,
very
right?
important.
Very important.
And even before you put your catheter in, you know where you need to go. So you save time because you don't have to keep, looking around, injecting dye in this vessel, that vessel to see where the blockage is. Recently, interesting thing happened in our hospital group. A patient was admitted in one of our hospitals. The grandfather was in the hospital with his grandchild as an attendant.
I see.
He had a stroke in hospital.
As an attender?
As an attender. He was rushed. MRI was done. He had a basilar artery occlusion. You can imagine a basilar artery is one of the most critical arteries in the brain, supplying the entire brainstem. If that causes a stroke, the patient is virtually gone. Like you can declare him in a few hours. He was taken to the cath lab and the basilar artery was stented and the occlusion was opened up. In 48 hours, this gentleman walked home.
Wow. Amazing.
So it's really making a tremendous difference to be, first of all, able to identify that he had a stroke, and then rapidly, treatment was initiated.
So that was my question. Actually, that's a good educational point for the audience as well. Do you remember what was the presenting sign for that patient?
He just fell unconscious.
Fell unconscious.
Suddenly.
So
again, that suddenness is what alerts us to the possibility of a stroke.
So, and he didn't wake up because if he woke up, then it will be the transient ischemic attack.
Correct.
The second thing is he was in the hospital, so we met the 3-hour criteria right there.
Yes.
So, when you say the FAST acronym, the one thing that we should keep an eye on is change in the symptoms.
Yes.
Change in the response of the patient.
Sudden onset.
Yes. Okay, super. So now we talked about the decreased blood supply. You talked about removing the clot and everything. Now coming to your field, where actually there's a leak of the blood.
Yes.
Tell me what you do in that situation.
So in cases of hemorrhagic stroke, if the stroke volume is not very large, we don't operate. There are again certain criteria. So if the blood has leaked into the ventricles and is causing hydrocephalus, which is increased increased fluid inside the brain because of the blood, which is blocking the egress of the normal cerebrospinal fluid, then we may have to intervene by putting a drainage tube. Again in hemorrhagic stroke, our threshold for intervention is quite high. We don't want to intervene too much because the brain has already been severely damaged. So by doing surgery, are we going to really achieve anything better?
Got it.
So we only intervene when the hematoma is expanding.
So when the blood clot is huge.
Yeah, when it's starting to expand and the patient's conscious level. So what we call the Glasgow coma scale. Incidentally, it is almost exactly 50 years since the Glasgow coma scale was introduced. Which has changed the way neurosurgery is practiced all over the world. So if that GCS is falling, then the patient is rapidly losing consciousness, like within a few minutes to hours, then only we intervene. And when we intervene, there are various, again, surgical options depending on the scenario. So if it's a very large clot, then we do an open surgery and we do what is called a decompressive craniotomy. So the thing is the skull.
Yeah, I want you to be very descriptive.
Yeah, the skull is a closed space, right? Because it's confined on all sides by bone. There is no place to expand. So if you look at, there is a very famous doctrine in neurosurgery called the Monro-Kelly doctrine. So the Monro-Kelly doctrine states that the skull has a fixed volume. And there are 3 things that occupy this fixed volume. One is brain matter and the nerves. Second is blood. And third is fluid. So when one accumulates, it will invariably accumulate at the expense of the other 2. So you cannot have a situation where blood is accumulating and brain is fine. Right? So when the hematoma is expanding inside the skull, we need to relieve that pressure, because intracranial pressure is a very key determinant when it comes to conscious level of a person. So in cases where there is a lot of increase in intracranial pressure because something is accumulating, which should not be accumulating. So it may be fluid, it may be blood, it could be tumor, which is coming from the brain. So these 3 things will cause an increase in the intracranial pressure. And therefore, we need to relieve that pressure. Now, we can relieve pressure by either draining out fluid, by draining out blood, or by expanding the skull.
Expanding the skull is opening up.
Yes. So we make an incision, big incision. We cut out a piece of bone. And the covering of the brain, we open it up. We give the brain place to expand. That is a life-saving procedure done in very critically sick patients.
Emergency.
Where there's no time. Where you're losing the patient, and if you don't intervene immediately, the patient may not survive. And then that bone flap, we call it a bone flap because it's a cut piece of the skull. We place it usually in a pocket in the abdomen, subcutaneous, which is your area.
Yeah.
So that's where I think, apart from the gut microbiome, that's where we intersect a little bit.
We prefer the gut microbiome.
So we place it in a subcutaneous pocket and then we close up that thing. So it's like a little, like how kangaroos have a pocket. So we place the bone there, and when the patient recovers, we put the bone back.
So I've seen that happen.
Yes.
A couple of my patients during my, talking to you, refreshing my neurology rotations in my internal medicine residency. That once you put that skull back in the subcutaneous pack, it is depending upon the patient's recovery.
Yes.
It could be 6 months. It could be 1 year.
Most patients would recover within about 2 months or 3 months. Yeah.
2 months.
Depending on how well they do other things like age, other comorbidities.
Got it.
Ventilation, tracheostomy, those sort of things.
So, overall, the prognosis is very not good. I mean,
for hemorrhagic stroke,
not good.
Not
good. Going back to why this hemorrhagic stroke happened, the key thing, in my opinion, is hypertension.
Absolutely.
Right? Hypertension.
Absolutely. So, before I go on to hypertension and hemorrhagic stroke, the other new way in which we remove hematomas from the brain is endoscopy.
Through craniotomy endoscopy? Or
yes.
Transpinodal?
Craniotomy. So, we make a small hole in the skull and then we introduce an endoscope into the blood clot. And then using irrigation and suction, we take out the blood clot to relieve the pressure.
Are you able to access the blood?
Yes. Yes. So, it's much less traumatic, but it requires obviously a much higher level of surgical skill because you have to be able to remove the blood clot to relieve the pressure. If you're not able to remove it, then the pressure is still going to remain and you're going to have to do that same open surgery again. So you don't want that situation.
Is that why you said stroke certified hospital?
Yes. Stroke, there is something called a stroke ready hospital and a stroke certified hospital.
I see. I didn't know the difference. Tell me, what's the difference?
So stroke ready hospital is where they can do basic care. So they cannot do advanced like catheter angiography and so on. But at least if you're coming there in the right time, they can diagnose, is it ischemic, hemorrhagic, and if necessary, they can give the clot busting medications. But if you want more advanced care, then you have to go to a stroke certified hospital.
Okay. Good. So, wow. So
coming back to hypertension.
Thinking about all this, I know it's fascinating for us as a medical professional, but it's better that we don't end up in that place to start with.
Yeah, let's talk about how to prevent strokes. I think that's more important than treating them.
No, I think it's a fascinating thing that I've seen your social media profile and everything. You are the, highest trained person in your field. At least from a gastroenterology standpoint, MCH in NIMHANS and neurosurgery is not it's not a joke. You have put in all the effort. I really want to bring out that field of yours.
Sure.
Rather than, everybody loves your social media profile in terms of your diet, nutrition, sleep, but I want to project in a different way.
Understood.
That this is what your bread and butter is. And people think that I'm a full-time YouTube doctor as well. I also do some procedures. So that's why it's a platform for the medical professionals to come here and then talk about their bread and butter. And at the same time, having this preventive action to our audience that, hey, this is what we do when you become sick.
Yeah.
My whole point is we don't want to see you in the hospital.
Absolutely.
So in your case, do you think that all this bleeding, stroke, majority related to hypertension?
Almost always. Yes. So what I've been seeing, especially in the last, it's surprising that you asked about this particular question because in the last couple of months, I've seen so many patients who have undiagnosed hypertension. And their first symptom of high blood pressure is a hemorrhagic stroke.
Oh my God.
It is devastating, right? That you don't even know that you're suffering from high blood pressure, such a treatable condition. And you end up in the hospital having either lost consciousness or lost strength on one side of your body and you're unable to speak. And
that's your first sign.
First sign of hypertension. That just goes to show that our primary prevention is... has a lot of lacunae.
Educators in terms of the numbers that patients should look for hypertension maintenance?
So, obviously, in my opinion, anything above 140 by 90 is a red flag. But again, I have a lot of belief in how blood pressure should be correctly measured also. I think there's a lot of lack of understanding and information about the correct way to measure blood pressure. And people tend to think that blood pressure is not a serious problem. My blood pressure is a little bit high.
Yes.
Sometimes if I get a little headache, I take medication.
Yes.
That's absolutely not the way to go about it.
My peripa says it's only 180. Guys. Usually it's 200.
And also they think that they should be having symptoms for them to take treatment. And many people believe that you don't need to treat blood pressure unless you're symptomatic. So they will often skip their blood pressure medication, maybe because they're feeling a little bit tired that day. So they think maybe my blood pressure has gone too low, maybe. And that's not the right way to approach it. So that's from the patient's perspective. I think patients need to begin to understand that blood pressure is a metric that you cannot measure in a lab. You have to be confident that you're getting your blood pressure checked by someone who knows how to reliably check it every single time. Secondly, you need to be checking your blood pressure in the same replicating circumstances every single time. So preferably by the same person, using the same apparatus, in the same clinical setting, same position. You should not have just, walked 2 flights of stairs and then measure your blood pressure. So you have to replicate it in the exactly similar way. And only then, when you have a long record of blood pressure, can you say that your blood pressure is really normal or is it trending towards abnormality.
So let's say a fit 40-year-old guy like me, maybe fit is a 2.
No, you are fit. No question about it.
Okay, a 40-year-old guy like me. Should we measure blood pressure like every month?
I think you should measure it every opportunity you get.
Is that right?
Yes.
In
of
US,
course, if you have several recordings which are normal, then probably you don't need to be as conscientious about it. But definitely once a month for sure.
So in US, you walk into a pharmacy, there is a blood pressure machine recording thing. So whenever I go, I actually measure my blood pressure. The second thing is, let's say I'm waiting. Sometimes, we wait for patients in US.
Yes.
At that time,
we also wait.
So at that time, I also check the blood pressure. The other thing I really want to get the message across is, let's say your blood pressure is like, I'm always on 115, 120. But when I had this heart rhythm abnormality, my blood pressure was 96, 90. Normal, but it is not normal for me at that time.
Yeah.
So the change in the blood pressure was also significant. It is more important when we go on the other side. So you were like 105, 110, but now you are 122, 126. Then there is some stage 1, stage 2 that is kicking in.
Yeah.
So you said you measure blood pressure at every opportunity that you get. Let's say that your blood pressure is 145 and your primary care physician has put you on medication.
Right.
Okay. And then people take medications. What is your advice to them in terms of, how do they monitor that?
If you're on medication, I think it's all the more important that you check it. Preferably if you are able to do it at home with a blood pressure monitoring apparatus. But you have to be aware that blood pressure monitoring apparatus can have an error. And most of them have a predictable error. So they're always within 10 or 20 millimeters off from the doctor's measurement. So calibrate your blood pressure. Take your blood pressure apparatus to the next doctor's appointment. Get the doctor or the nurse to check your blood pressure and then check your blood pressure with your device and just understand what is that offset. So that when you check your blood pressure at home, for that particular apparatus, what is your normal blood pressure? Because there is going to be a change. So that is what I advise people to do.
Nice.
I'm not again a physician and I'm not qualified to treat people for blood pressure, but to me, making them understand the importance of blood pressure is my job.
No, of course. And if the machine doesn't work, you can send it back to Amazon for refund.
Whatever. Get another one.
So more importantly, I tell this to all my patients is that if you have hypertension, having a blood pressure apparatus at your home is a no-brainer. It has to happen.
Absolutely.
It has to happen.
Absolutely.
And then you said, measure in repetitive circumstances, same location, same position as much as possible and maintain the daily log.
Yes.
And then ideal is to decrease less than 120/80 would be the preferred one.
Preferred, absolutely. And we can talk about many of the lifestyle changes that one can take to get off blood pressure medication. May not be possible in all cases, but I think if there are certain extenuating circumstances like smoking, obesity, inactivity, these are all remediable. And you can actually go off blood pressure medication if you take care of these factors, which is the ideal circumstance.
Of course. And that's why people should follow your channel where you talk about, sleep, obesity and everything. And talking about this, I just couldn't get that patient out of my mind. So he's a very young, 60-year-old. I mean, he was...
Not old at all by today's standards. Yeah.
But he was hypertensive and he was on metformin for early diabetes.
Right.
And that itself is a big risk factor for the stroke.
Yes.
So the thing that I couldn't get out of my mind is he was walking, talking, running, and we just had a family get together the night before. We played games and the whole family was so much fun. The next day morning, we lost time, number one, when the symptoms happened. And then after that, by the time we reached those insurance issues and, they didn't take insurance, unfortunately. And then I was in the medical hospital, so I have to call people. I pull my doctor's card and everything. And I say, just take care of this and we'll figure it. But because we lost the window, it was not considered as an emergency at that time. So what happened, it turned out to be a non-salvageable injury, where it was hemorrhagic stroke. And exactly what you said, the stroke is not big enough to consider as an intervention at this time. So we'll just see how it goes. In 2 days' time, it got bigger. Got bigger. And they did emergency craniotomy. Exactly same thing, whatever you said. You decompress the brain. And they put that thing on the subcutaneous thing. He didn't recover, unfortunately, for a long time. And the impact that had happened on the family, right? So he was basically bedbound. His right leg and right hand didn't work. He started having bowel and bladder problems, and he cannot even walk to use the bathroom. This family is pretty financially very comfortable, but they didn't have the manpower to take care of. It was so devastating. And I was just thinking, looking back, if we could have just controlled the blood pressure better way, maybe we don't even have to look into this. Yes, I know this is some severe case. Some cases they do recover, but why should we put our family at a risk? So that's why I always talk in my channel, also in your media, what you're proposing is primary prevention, right? Primary prevention, hypertension. So we talked about when you have hypertension, what do you do? And we talked about hypertension causing stroke, and we don't want you to be in the hospital because of that. Now we're going to talk about what are the small things that can be done to prevent hypertension to start with. If you have to list it down, what will be your number one priority in terms of lifestyle change?
Exercise.
Yeah.
I think it's quite well known in the medical science as well that regular physical exercise prevents high blood pressure. So in fact, I think even 20 years ago, the recommendation was that if you have blood pressure, you should be walking at least 20 minutes a day as a form of exercise, not as part of your regular routine work. And just that walking itself will reduce your blood pressure problems. Because exercise has numerous health benefits, more than any doctor, any intervention or any medication can possibly provide you. But it's just that people need to understand that, accept it, and start doing it. That itself will improve health of people by leaps and bounds. So if you are hypertensive, definitely performing some form of physical activity for at least 20 to 30 minutes a day. The WHO recommends 150 minutes of moderate physical activity per week. So we say 5 times a week, 30 minutes per time. 150 minutes is recommended. And over a period of time, that should bring your blood pressure into better control. Now, whether it will take you off medication or not depends on many factors.
You talk about the zone 2 of your physical activity. So, in general, when we talk about exercise, at least in Indian community, walking is one of the most common thing. And there is a plus and minus to it. Plus is any physical activity is good. If you're in the couch or walking, of course, please get started. But considering just walking alone is a physical activity, you might not get the same benefits. Your hypertension might not be controlled.
Exactly.
And that's where you talk about the zone 2, where you exert your heart rate a little bit. Please educate on that.
So, as you know, the body is a very adaptable organism. And when you keep doing a certain activity over and over again, your physiology will adapt to it. So, if you were to climb 10 flights of stairs every day, after a month of doing that, the 10 flights won't seem that difficult. So, although you're doing the same exercise, the effect of the exercise has changed. So, that is something people need to understand, that although you are doing exercise every day, it does not have the same physiological effect on you if you continue to do the same exercise 3 months or 6 months down the line. So, there is a physiological adaptation that happens within us. So, for the same level of exertion, you will be actually expending less of a physical load than you were doing when you started. So, the only way to understand how much of exertion you're actually putting into an activity is to measure your heart rate. Because that tells you what is physiologically happening to your body when you are engaging in that activity. So, I can guarantee you that somebody who starts walking 30 minutes a day, in 6 months, the heart rate that he or she started walking at would have dropped. So that 30 minutes, 6 months down the line is not going to feel like 30 minutes. So either you have to walk at a faster pace or you have to walk longer. So measuring your heart rate is a very important step. If you cannot measure your heart rate, and I understand not everybody wants to get into the smartwatches or wearing a heart rate strap. Smartwatches, incidentally, are not very accurate because they are wrist heart rate measurements. So actually, a heart rate strap is what is more accurate. But if you don't want to get into that, the very simple rule of thumb is you should be walking at a pace where maintaining a conversation is a little difficult. So it's not like how you and I are talking now. So if I was on the phone talking to you and you were listening to me talking and I was performing a zone 2 activity, you would be able to tell that I was exercising. So it's slightly labored, but I'm able to talk. So if you can at least achieve this, that's more than enough. Because then you know that you are exercising at zone 2. So this is a scale that we use called RPE, rate of perceived exertion, which is actually very accurate, provided you understand that you're doing it the right way. So you don't need any fancy devices, you don't need measurements, just RPE is enough.
Most of the time people go for walking in the evening. After
they'll be
work,
chit-chatting while they're walking.
On the phone, they'll be like, what is the recipe for medu vada? So I've said this repeatedly that if you are talking on the phone and walking, then walking is not good.
Yeah.
I mean, it is better than nothing, but so that's a very interesting point. That same amount of walking will decrease in its efficiency in the next 3 to 6 months.
Yes.
That's fascinating. So you do cycling.
Yeah.
You do cycling. Cycling is considered as zone 2 to start with, or even on cycling?
Cycling can also be zone 1.
Zone 1.
Yeah. You can have all zones in cycling. You can be doing very
relaxed
ride, like what we call a cafe ride. Where we all just ride to a coffee shop and we have coffee, chit chat and come back. Sometimes you need that kind of ride also.
Usually people go to A to B.
So we have that also, and then there are all zones in cycling which are possible. So I commute by cycle also.
To work.
Yes, because it's the fastest, most predictable way. If I have to get into the operation theatre at 8 o'clock sharp, if I take the car in Bangalore, there is no guarantee I'll be there. So
you'll be there tomorrow.
Maybe tomorrow 8 o'clock.
So you bike.
I cycle to work most of the days. Yeah.
Nice.
And that's my zone 1.
That's a zone 1.
Yeah. So I cycle at a relaxed pace. And anyway, with the traffic interruptions, it's a slow ride.
Nice. In your patients, after the surgery, let's say you have a bleed and then you remove the clot and all those things. When you talk about exercise, what is the general reception among Indian community right now? Are they resistant? Are they hesitant? Or they want to do it, but they cannot do it?
So a lot of my patients post-surgery, like spine surgery particularly, I advise them that the only way that you can keep your spine healthy. So whatever you did in your life up until now caused this problem. Now, going forward, if you continue to do the same things, you will end up with the same problem. Albert Einstein's famous quotation is, insanity is doing the same things and expecting different results. One of my favorite quotations.
Of course.
So I tell them, if you do the same thing, you're going to end up with the same problem and you're going to come back to me and I may have to operate you again. So you have to do the exercises and you have to take care of your back. Exercise is a non-negotiable part of your treatment. There is no way you can escape it. It's part of your life now. So most of them get it, but a few of them, a year down the line, everything is healed, they're back to normal. They gradually stop doing the exercises. As you know, that's human mentality. And I believe that I try to emphasize consistency. I don't want you to be exercising like a gymnast. But I just want you to exercise 30 minutes every day, dedicated to your spine. That's all I ask for you. Not even every day, 5 days a week. Consistency trumps everything else, in my opinion.
Consistent from the duration.
Yes.
That creates that neuroplasticity. Form a habit.
Form a habit, make it part of your lifestyle, take care of yourself, be, what can I say, be a campaigner for your own health. Many people don't have they're not supporting their own health. They are not the voice for their own selves.
Of course.
Maybe for various reasons. They don't have time, they don't have the mindset, they don't feel they are worthy enough in some cases. So I think people need to start standing up for their own health and being a part of that process.
That's how was a wake-up call for me in my personal journey as well. So that's why I said always, it's time to prioritize your health now. I think it's the bottom line for every doctor in social media.
In the airline, they say when oxygen mask falls, put on your own mask first and then help someone. So you can only be an asset to your family or your society or to the world around you if you are in good health. And that's why I made my health a priority also. Because I realized that if I'm going to be giving advice to people that you have to take care of your health, be fit. If I don't look fit, how can I give that advice?
This is a beautiful segue to a very controversial question I'm going to ask you. Why is this thing not happening among doctors community? I know many doctors, including me, okay, while I was training, while I was being in the education, I didn't care about my health at all. Only when I got settled down, and in my case, there was a health scare.
Yeah.
But I'm worried about the doctors community a lot. They put in a lot of effort, not only doctors community, many people, many profession, they put in a lot of work, lot night duty, circadian rhythm disturbances, sleep disturbances. What can be done to at least guide or get started in the right direction?
So my wake-up call also happened when I was finishing my MCH. As you know, my degree in neurosurgery. It was obviously a very, very stressful time.
Of course.
And we were given 1 month off to prepare for our exams because our professors knew that we've been working so much in the ward and that we didn't have enough time to read. So to save our face, they said, go and study for 1 month. At least you pass the exam. So at 1 month, I sat at home and I was fed constantly. Because I was studying something like 16 hours a day.
Yes.
And food was just constantly coming in front of me. And then finally, the exam got over. Fortunately, I passed. And I stood on the weighing scale. And to my shock, it read 90 kgs. And I was wearing size 36 trousers.
Damn.
That's size 36 inches.
Wow.
And that's when I realized, I said, this is a path to destruction, self-destruction. I got quite serious after that. Unfortunately, my father passed away a few days before I finished my residency. But as soon as all those rituals were over, I said, I'm getting straight to the gym. But I know that what you say is very true. I think in our profession, we see a lot of our colleagues who don't have the time or the intention to keep themselves healthy. And I don't know what the reason for that is. Maybe it's lack of awareness. I don't think it's really lack of awareness. I think they all realize in the back of their minds that they should be spending some time for their health. But probably it's family commitments, work commitments.
I think lack of time.
Lack of time.
I shouldn't say lack of time, not prioritizing. Because I have been in that situation, you've been in a situation where when something else is trumping, we think that, okay, time needs to be dedicated to that particular work first. And we can take other fitness. What I learned from my personal experience is that, let's say, for example, it's a very good advice or suggestion for a young medical professional where he's trying to read a lot, similar to you, 16 hours a day. I also do the exact same thing, 17, 18 hours a day. I was thinking that going to fitness, I'm wasting like an hour or two. Why don't I focus on reading some more? Now I'm realizing that if I would have done that, I would have focused more. I would have grabbed more.
Yes.
The absorption retention will be
also, I think I did a recent reel on this about how to incorporate physical activity into your daily life. So that's why I got into commuting by cycle, because then it means that as part of my day-to-day work, I have to go to work.
Yes.
I might as well use that time to get a little fitter. It may not make a massive difference. I may not be Lance Armstrong or somebody else like that, but at least I will be spending some time towards my physical health.
Of course.
And my mental health. Because I think we also underestimate the importance of being physically fit. Helps us be mentally fit also. And I think that's something we don't understand enough. Even our population doesn't realize that a person who's physically fit is also mentally fit. Your sleep is better. Your cognition is better. Your awareness is better. Memory is better. I think so many things are benefited.
Is there what the BDNF comes through?
Absolutely. I'm glad you brought that up. One of my favorite chemicals.
Your brain stimulating chemical. Why don't you talk about that?
So BDNF stands for brain derived neurotrophic factor. Let's not get into the real name because it's a mouthful and most people will not appreciate such a long name. But what it does is it's something that is released when you do high intensity training. So when you do like a sprint or you do something which is like zone 5, VO2 max kind of workout, then your body releases BDNF, and BDNF crosses the blood-brain barrier and crosses into an area of the brain called the hippocampus. And it prevents neuronal degeneration in the hippocampus. It actually may be, we don't know yet for sure, but it may be stimulating what is called neurogenesis, means formation of new synapses and nerve cells in the hippocampus. The hippocampus is an area of the brain that is crucially important when it comes to aging, brain aging. So we know we have in our society, in our family, in our friend circle, people who've become older, who've lost their cognition and their ability to remember things. That we call dementia.
Yes.
The crucial structure in dementia is the hippocampus. The hippocampus is considered the seat of human memory. If you can prevent degeneration in the hippocampus, you can improve the quality of life of these elderly people so that they retain their memories and their cognition as they get older.
So you're saying that exercise can be a preventive factor of dementia?
Absolutely. No doubt about it. I have friends in my cycling circle. Particularly good example is a guy who's almost 80 years old, still races his bicycle, is absolutely sharp, travels all over the world with his bicycle, books his own tickets, catches his own cabs, does everything by himself at the age of 80, all because he still does high intensity exercise.
I've seen in my experience, most of the people who does that, they look younger as well.
Yes. So when we say, you're reverse aging, do high intensity exercise. Best way to reverse.
Like you. You have been, how long you been cycling for?
Exactly 15 years.
15 years?
Yes.
Wow. It's clearly visible. I mean, not 15 years, but on your skin. You look much younger than your age. For sure. So beautiful. So after this episode, everybody's going to exercise.
I really hope and pray, especially
bike to work.
especially our colleagues.
At least use the cycle to work.
Walk to work, bike to work. Take a walk during your lunch break. Do something. Walk up the stairs. So, interesting study from the UK Biobank. It's called VILPA. Vigorous Intermittent Lifestyle Physical Activity. VILPA. Which will test your willpower. So, they gave people a little watches, accelerometers. And they said, just do brief, short bursts of high-intensity exercise. Once or twice a day. And they followed up these people for many years. And they found that just these, what they call exercise snacks, made a huge difference to
people
their
thought
outcomes.
It was murku.
Yeah. They thought they can eat snacks while doing exercise. That's not what they meant. But exercise snacks made a difference to these people's cardiovascular outcomes. So they had fewer incidents of stroke, heart attacks, and even cancer. So very interesting that just this, you don't need to do something phenomenal. Right? You don't need to suddenly change your life and do 2 hours of exercise every day. Just incorporate a little bit of physical activity into your day-to-day routine. We already lead very sedentary lives.
Right.
We wake up in the morning, we sit at the breakfast table, then we sit in the car, we go to work, we sit at work, we sit in the car on the way back. Yeah, we use the elevator, we don't use the stairs. We come back home, we sit in front of the television or in front of our screens, we do more work and then we go to sleep. Already too sedentary. Sedentary lifestyle, unfortunately, is an outcome of human so-called progress. And yeah, technologically, we're tremendously advanced now. We don't need to lift a finger to get anything done. Everything happens at the other end of a screen. But it's also hurting our health tremendously.
In your practice, sitting is the new smoking.
Yes.
How common is that?
Tremendously. Every week, I get so many young people, students, people who work in offices, a lot of the people from the IT profession who are forced to work many hours in front of a screen. They're constantly suffering from neck and back pain. And they don't get time for exercise. So it's a perfect storm.
Wow.
You're sitting in front of a computer. You're stressed. High levels of stress, cortisol. Because you're stressed, you find comfort in highly refined foods.
Ultra-processed foods.
You have no time for exercise. What do you think is going to happen to this person in 10 years, right? It's very obvious. All the things that are going to be hurting your health from a metabolic perspective are already happening and your sleep is disturbed. So 5 things are already disrupted. It is invariably, your body is not bulletproof. It is invariably going to break down somewhere. And if you look at their metabolic profiles, I ask some of these people when they come to see me to do their blood investigations, they all have dyslipidemia, poor vitamin D, low B12,
glucose levels high,
HbA1c is climbing. It's just a perfect storm.
So I used to tell my patient is that, when I grew up, when somebody wants to smoke, the parents doesn't have to know, right? So they will go outside and then smoke. Now, parents should see whether the guy is moving. If you want to sit for more than, 2-3 hours, you need to stand.
Yeah.
Right? You need to stand and then parents should supervise and then say, if you don't stand, then you don't come inside the house. Something like that. I'm just saying that movement has to be incorporated as a daily lifestyle.
So that's why when we took a short break now, I told you to stand up and walk because sitting continuously is not good for our spines.
So even for doctors, when we are seeing patients,
yes,
if it is in the hospital, we walk in between other rooms.
Yes.
But if it is an office-based thing, it is most of the time spent on the screens as well.
But I also encourage me and my colleagues when we are in the clinic to stand up and walk around. Of course, when we're in the operation theatre, we are already standing and walking around quite a lot. But even there, when you're standing for such a long time and you're looking through a microscope and you're very focused, your posture tends to degrade over a period of time. Particularly, your muscles start to fatigue. So, your back muscles, your neck muscles and shoulders tend to fatigue. And then you can actually cause a lot of problems to yourself. So I came across an interesting article which talked about this, which said that neurosurgery is a very physically demanding specialty. And the article was called The Athletics of Neurosurgery. And he said neurosurgeons, in the conclusion in that article said, neurosurgeons need to train like elite athletes.
Wow.
as far as strength training is concerned, because you are performing such a delicate job and you're putting such heavy physical demands on your body that you need to train yourself to be physically strong enough, mentally alert to perform that job. And that is why I take my fitness very seriously.
Wow. Wow. I mean, everybody should take at least one. The biggest takeaway that I'm getting is that I'm very inspired by you that despite being a busy and hectic schedule, you're able to maintain your fitness, which is not an easy thing, but you just incorporate
Like you said,
it somehow.
It comes to priorities. Again.
Priority.
Yeah.
So you have also talked about dancing in one of your reels. Right? So did you just talk about the dancing as a part of physical activity, or what was your take on that?
So I think music and dancing are wonderful stimulants for our brains. And anything that leads to a feeling of happiness, oneness with things around you is very rejuvenating. People, I think, they've forgotten the importance of dancing. There was a time, I remember when I was growing up, my parents would actually go to places where there was dancing. So they would dance and then they would eat. Right? Now we just go and eat. We don't do the dance.
And watch other people dancing.
We watch people dancing on movies and screens on our phones, but we don't do it ourselves. So, that was a wonderful way, as you know, when you are performing physical activity during a meal, your glucose load is also taken care of. So there was such there's so much wisdom in things that our grandparents and our parents told us.
Right.
We've forgotten those important pearls of wisdom. Where, in the British times in India, when we were ruled by there was a very common thing where there would be a dance and dinner. So people would go out, they would dress up. Nowadays also we hardly dress up, right? When we go out, we just wear any casual clothes. They would dress up nicely and go to a dinner, dance, and then eat. So what are you doing? You're actually expending energy. Your muscles are working. So the food that you're eating is not as damaging, and that's why people were thinner those days. You didn't see the rates of obesity in those days as you see today. People did not spend their time looking at screens and TV. They were busy doing physical stuff.
Before was dance and dinner, now it is drink and dance. I'm not even kidding. We can talk about that really briefly on social drinking as well.
Yeah.
In Bay Area, where I am practicing, social drinking is something very common.
Yes.
Where drinking itself is bad. Where women, when I grew up, when women drinking alcohol is something that I have not heard or seen, or even if it is done, it is very done privately. But now it is very common, especially among Indian community. Some at least in US, what they say is, as long as you drink like 5 ounces of alcohol, 1.5 ounces of liquor, and 12 ounces of beer, it is reasonably okay. So the problem is they give the safe limits, and people think that is completely okay. I think that is where the problem is, where even 1 ounce of alcohol is going to disturb the circadian rhythm, disturb the liver, disturb your whole gut microbiome, all those things.
Yeah.
And I really want to see what is happening in your practice in terms of social drinking. Is it getting more common?
Yeah, it is definitely more common. As you rightly said, it's across age groups, across genders. It's no longer exclusive
for men.
Yes. Also, I have my own beliefs about alcohol, but my biggest grouse with alcohol is its effect on sleep. Also, I think there was a recent study which I think I may have spoken about on Instagram, where there was a belief, even amongst doctors, that a moderate amount of alcohol is good for your heart.
Yes.
I think this came out of resveratrol. Red wine and resveratrol and the antioxidant properties. I think it's very clear now that the resveratrol story is dead and buried. I don't think anyone doubts that any longer. Maybe a few people who still have a stake in the resveratrol companies.
I always say that the same resveratrol is in eggplant and brinjal as well.
Yes.
So you're saying that alcohol disturbs sleep big time.
Yes. So if you were to, I know people who track their sleep very closely with very good tracking devices. And when you track your sleep, just after one glass of beer or a glass of wine, you will see a difference in the quality of your sleep immediately. So and even there are some beliefs that if you have alcohol at lunchtime, it will not affect your sleep. But if you have it closer to dinner time, then it may affect your sleep. So have it at lunchtime instead of having it dinner time. Fine. That also will affect your sleep. So if you are careful enough, if you really are a nerd who wants to know what alcohol is doing to you, get a bio tracker, like one of the good bio trackers, and see what the effect of alcohol is on your sleep. You will be amazed how disruptive even one glass of wine can disrupt your sleep.
There was a study that said that especially people drink wine usually at dinner.
Yes.
Dinner time. It's in US. It's extremely common.
Yes.
Without wine, there could be no dinner, but there could be always wine.
And it's all paired now. They're pairings. You have to have white wine with this kind of dish and red wine with that and rosé with something else. Yes.
Right. Fish goes well with white wine.
Yes.
That's what they say. Red fish. I don't know. Red wine is red meat, something like that.
Yes.
And they make a big business out of it.
Correct.
And there was one study that said that, okay, so, I mean, I'm a big supporter of circadian rhythm, and usually the hormones has to rest as well.
Yeah.
So as the sun sets, the suprachiasmatic nucleus, as you know, it goes down as well. So some of the hormones gets activated, some of the hormones gets rest. But that one sip of alcohol delays the sleep initiation by 90 minutes.
Yeah.
90 minutes, already you only have like 5-6 hours of sleep.
Yeah. And resting heart rate goes up.
Resting heart rate goes up.
So normally when you're in deep sleep, your resting heart rate, that's when your body is repairing itself. Parasympathetic predominance, sympathetic quietens down. It's your rest and digest kind of time when the body is repairing all the damages from the day's stress. Your heart rate goes down. So that the very fact that your heart rate is not going down means that your sympathetic system is overactive.
I'm again a controversial question to you. I know you can handle.
I like controversial questions.
You are handling neurosurgery cases. This is nothing for you. So many of our colleagues as well have. I mean, I was completely shocked to see a doctor's meeting, and at the end of the meeting, people are waiting for the presentation to be done.
Yeah,
where the liquor is being served, right? It comes into the social drinking thing, mainly in the US as well. So what is your take on, okay, so I'm just drinking once a week, once in 2 months, once a month. Is that reasonable to argue that, okay, once a week, alcohol is not going to bother you that much?
Yeah, I think it's probably okay. I don't believe in it. I believe in completely staying off alcohol as much as possible. Maybe very occasionally when, once in 3 months or 6 months or something, when there is this really, really special occasion, I may have some alcohol just to give company to someone. But I try to just completely stay away from it. I don't believe alcohol has any beneficial value. There may be a social aspect to it, maybe a stress reduction aspect to it in such situations where you could sort of say that, yes, you could argue that it is beneficial. And I don't think it really will disrupt someone's life too much if they have it occasionally with in a social setting with friends and it de-stresses them. I think it should be okay.
So in our gut microbiome area, so where we say that, hey, anything that you can do to increase your good gut bacteria,
yes,
we would love it to do.
Yes.
One study has shown that, again, the same thing, social drinking wipes out the good gut bacteria because they just cannot tolerate the alcohol effect at all. So it is easier to destroy something rather than creating.
Absolutely.
So it took a lot of time. One sip of alcohol to replicate the same amount of good gut bacteria, they have to spend 2 weeks of high fiber intake. We are talking about like 40 grams, 50 grams of fiber per day, where we are even finding it difficult to reach 25 grams of fiber per day. So I always say that, hey, it's always good to destroy something. To supplement, you need to put all the hard work.
So I'm glad to hear this. Now I have more ammunition against alcohol.
Yes, of course. It's a big thing as well. So alcohol is disturbing sleep. So sleep is one of the most important thing for the hypertension thing that we talked about.
Yes.
I think that if you sleep more than 7 hours a day, your blood pressure will come down on its own eventually. I think that's the most important problem for especially all the software workers, engineering workers. I'm telling you, I'm in US, right? All those people are having a very good life where they are working between 9 a.m. to 5 p.m.
Yeah.
And all people here are working overnight.
Yeah.
Overnight. I know they are very young, they are very enthusiastic at this time, but it is taking a toll on them. What will you say for people who are night shift workers where sleep is a huge problem?
Yeah, so I think there are many problems with not getting adequate nighttime sleep. So even if you say that I'm getting adequate daytime sleep because I'm working night shifts, it's not the same quality. And certainly it does not have the same physiological effect. One of the most important things about sleep is reduction in your cortisol levels, activation of your parasympathetic nervous system, consolidation of memories, improvement in cognition. Because there's a very important system in the brain which has been spoken about, I have spoken about it, but is not highlighted enough. This is called the glymphatic system. The glymphatic system is activated only during deep sleep. And when you are sleeping in the daytime, your pattern, your sleep architecture changes. You do not get enough of deep sleep. Although you may be sleeping, sleep, just because you sleep 7 or 8 hours, it's not just the duration of sleep. It's the quality of your sleep also that matters. So you need to have deep sleep, REM sleep, because these components of sleep are very important from the point of view of restoration of various processes in the body. So only when you're in deep sleep does the glymphatic system get activated. And when your glymphatic system is activated, the cellular debris, which is the waste product from your neuronal activity, as you know, the neurons are hyperactive parts of our body. That's why they consume so much of oxygen and glucose, because they're constantly working. It's only during deep sleep that your neurons are resting. That is an opportunity for your body to get rid of the waste that the neurons are generating. Any neuronal activity is going to generate waste products. How do those waste products leave the brain? The brain is an isolated part of the body. The brain and spinal cord is protected from the rest of the body by the blood-brain barrier. The only way that that area can be vacuumed out is during deep sleep when your glymphatic system is activated. And if that is not activated, this progressive cumulative load of waste products which accumulate in the brain is considered to be one of the main drivers of neurodegenerative disease. So things like Alzheimer's, Parkinson's may even lead to predisposition to strokes.
Wow. When you say deep sleep, you're talking about 7 hours that...
No, when I'm talking about the phases of sleep.
Phase of sleep.
Yeah. So
the
you
REM
have
sleep.
REM sleep, and then deep sleep is delta sleep, stage 4 sleep, where if you were to connect EEG to the person who's sleeping, you would get these very slow delta waves. So where neuronal activity is at its very lowest. So it's just a rhythmic, slow electrical activity that's just gently pulsing through the whole brain. It's beautiful, actually.
It's beautiful. How about, is the same deep sleep can happen if you split the sleep, let's say 2 hours in the afternoon and 5 hours at night?
Typically, when people fall asleep, it's the first few hours is light sleep, where you are just falling asleep. And then deep sleep kicks in after a few hours. Also, very important thing to remember is when you are sleeping at the same time every day. Let's say you have a bedtime of 9 p.m. and you're sleeping, say, 8 hours and you wake up at 5 a.m. If your 9 p.m. bedtime changes one of the days, that is also going to disrupt your sleep. Because there is a growth hormone surge that happens in the first few hours, first few minutes after you fall asleep, which is always the same. And if you don't sleep at 9 p.m. one particular night, you miss that growth hormone surge. And that growth hormone surge is very important in planning the rest of your night's sleep. It tells your body how to plan the rest of the night. So when REM sleep kicks in, when deep sleep kicks in. So it's like a setting indication to set the tone of your sleep for the rest of the night.
That's amazing.
So many parts of our sleep architecture that are so important. So quality, quantity, regularity, timing. Matt Walker has spoken about this in his book and in his podcast, QQRT. It's the 4 pillars of good sleep.
Quality, quantity,
regularity, timing.
So there was we did a study in San Diego about night shift workers.
Right.
So we talked about the gut microbiome and all those things. But at the same time, we were looking up the circadian rhythm abnormality. So that growth hormone surge was almost lost.
Yeah.
Completely lost. And that is clearly evident on the blood markers that we have been measuring during the study. And I think we are just catching at a very early stage where if we can just follow these patients in 10 years from now, and that is where the starting of this blood pressure, obesity, diabetes, metabolic syndrome, I have a strong feeling that this is the bottom line for everything.
And also disruption, I think, in the circadian cortisol rhythm. Very, very important. Imagine, because your cortisol levels are supposed to fall during sleep. And they're supposed to rise as you wake up.
Around 8 a.m.
Correct. 8 a.m. is the usual peak. Depending again from person to person, may vary according to the particular circadian rhythm of that person. But if your cortisol levels don't fall during sleep, there's ongoing inflammatory cascade, because cortisol is a pro-inflammatory hormone.
Correct.
So it has devastating consequences. I think people have now begun to understand, thanks to educators like Matt Walker and various other people, that sleep is such a crucial aspect of our biology.
Of course.
There's a reason why evolutionarily we have dedicated almost 1/3 of our lives to sleep.
Of course, right? 1/3 of the day.
Yeah, almost 1/3 of our day is dedicated to good sleep.
Good sleep.
Hopefully.
And you are a big proponent of, maintaining a sleep routine.
Yes.
And you have talked repeatedly about not looking at your phone before going to bed.
Yeah.
And the blue light interfering with your retina.
Yeah.
So let me tell you what I know, and you can tell me from a neurological standpoint in terms of how this works.
Sure.
So my understanding is, when you look at the phone, the blue light from the phone goes deep into your retina, stimulates the synaptophysin receptors, and then creates an artificial environment that, hey, this guy is really awake.
Yeah.
And that disrupts the melatonin secretion, and melatonin is a hormone that makes you go to sleep. Practically speaking, it is very difficult to avoid that situation.
I know.
in this wider world, in this very busy world. What will you advise your patients if they are having this sleep problems?
So a few things that I have found. Most of the things that I suggest to people, I usually try on myself. Because I think it gives me a little more insight into, how it feels. So one of the things, of course, looking at a screen as far as possible. Look at a dim screen. Try to switch on the red filter on your screen, because that's supposed to be less disruptive to your photoreceptor ganglion cells, which connect to your hypothalamus, suprachiasmatic nucleus, melatonin.
So the red light does not stimulate that much amount of...
Correct. Wavelength of red light is less stimulating. The other thing is, it depends on what activity you're performing. If you're performing something relaxing, like you're watching a movie which is making you relax, that probably is okay. But if you're doing work on your screen, which is, causing anxiety and stress, that probably is going to affect your sleep. So the activity that you're undertaking is also important. So if you're looking at your phone, I can understand. It's very difficult not to look. You're maybe getting messages. I also, in my profession, I constantly am getting messages. I have to keep answering messages, looking at reports and stuff like that. So I usually dim my screen. I try not to get super anxious or excited about what's going on. And usually some calming activity before sleep is beneficial. Meditation. I think breathing is a very underestimated part of our physiology. If you look at breathing, so, we know breathing is automatic. It's involuntary. We're breathing right now without having to think about it.
So breathing reduces cortisol levels as well?
Yes. So breathing is a bridge between the involuntary and the voluntary. And because breathing is under involuntary control, but can also be voluntarily programmed. You can use voluntarily breathing exercises to calm your nervous system down. It's a beautiful bridge between the voluntary and the involuntary.
You can control your parasympathetic nervous system. Wow.
Yes. So I think people need to get, harness that power. Meditation, breathing. Meditation and breathing usually go hand in hand. Some part of breathing exercise is part of the meditation. So you calm your breath down, slow it down, do more of diaphragmatic breathing rather than, intercostal breathing. Those things are known to be beneficial to promote good sleep.
As a neurosurgeon, what is your sleep routine for a day?
Well, part of it is a little embarrassing actually. But I'm a very early riser. I like to start my mornings very early. 4 a.m. is when I usually wake up.
Wow.
I usually do some form of lying quietly for a few minutes. One of the reasons is because I measure something called heart rate variability in the morning when I wake up, because that gives me an idea about how well rested I am. And it also tells me how...
So you have the heart strap?
Yes.
I see.
So I've been recently started using that about a month now, where I use a heart rate strap, which tells me my heart rate variability. It tells me how well I've recovered from my previous day, because my previous day can be a mix of many stressful factors. My workout, my work, my lack of, amount of just running around I'm doing. So I need to know in the morning when I wake up, what kind of workout I can do that day. Can I push myself, or do I need to step back a little bit?
Is there a number that you go by?
We look at a recovery score, but that's based on your heart rate variability. And then I go about my usual routine, and then it's usually a workout, and then I get to work. I try to be home most days by about 6 p.m. And then it's an early dinner. And then I do some amount of my time. It's my time after that. So I do some amount of... Nowadays, of course, it's Tour de France time. So I usually follow a little bit of the race, because that's the most exciting race of the year. And now, fortunately, we have access to live broadcast in India. So I'm enjoying that.
Nice.
And other days, it's some bit of reading, maybe watching some YouTube videos on surgery, watching some of your YouTube videos. Preparing for some of my Instagram topics, preparing for my next day's work, surgery. If I have to read up something about a little slightly more complicated surgery than I'm doing, or something different, then I will be doing a little bit of reading on that. I try to read something non-medical also, just from non-fiction. And off late, I've been also doing a little bit of spiritual stuff. So I do a little bit of reading of the Bhagavad Gita, which I find very insightful.
Of course. You do this before sleep.
Yes.
30 minutes before.
Yeah.
So ideal thing is you turn off the phone 30 minutes before, at least 1 hour before if you can.
Yes.
And then replace that with reading a book or something like that.
Yes. Reading a book, like a physical book versus reading a screen, I find the book is very calming, because first of all, there's no light coming from the book. Second is you're looking at print on a piece of paper, and you don't have to do anything with your hands except turn the page maybe. There's no scrolling, right? And the words are not like passing by you. You can always skim back one page, it's still there. Whereas on a screen, it's just going past you. So I find that very calming and relaxing.
Nice.
Just a few minutes. I mean, I don't even try to push myself to do like 1 hour. I'm just 10 minutes is is good enough for me.
Reading a book.
Yeah.
And then meditation at that time, or probably breathing exercise that we talked about?
I just lie down for a little bit, close my eyes, and by that time I'm so tired, I usually fall off to sleep. One thing I do regularly is wear earbuds.
During sleep?
Yes.
Huh.
The reason is that I find in India, generally, the environment is very noisy. So there'll invariably be some stray noises, which I tend to get very...
You're a light sleeper.
I'm a light sleeper. I may get disturbed by that. So these earbuds make a tremendous difference to my quality of sleep.
Nice.
And I think if anyone is having issues with ambient noise, or any ambient noise in your sleeping environment, wearing good quality earbuds is a lifesaver.
Wow. And also they talk about like using black screens to dim the light as much as possible.
Yes, absolutely. Yeah.
Okay. And in your videos, you always say about, no scrolling on the phone, right? So scrolling causes the blue light problem.
Yeah.
What can be done to stop it? Do you believe in blue light filter glasses?
Blue blockers are good, yes. Also, you can, on most phones nowadays, you have red filters which you can activate with just a touch of a button. So using that is also a good idea.
What does that do to your brain?
Couple of things. So in the retina, Nobel Prize winning discovery, intrinsic photosensitive retinal ganglion cells, which are very sensitive to light. And these blue wavelengths of light will activate those cells. And that will in turn suppress your melatonin release. Melatonin, as we know, is a very important hormone for the initiation of sleep. Second is looking at that blue light, particularly in the middle of the night, activates a part of your brain called the lateral habenula. Habenula is a tiny, tiny structure, very tiny structure, hardly known. It's a barely seen on MRI or even on brain sections. But it is connected to the retina. There is a retinohabenular tract.
There's a pathway.
Yes. And that stimulates the lateral habenula. It is known that the stimulation of the lateral habenula will lead to depression. So mental health issues by looking at screens is a real thing.
Wow. I mean, just people think that, I have done that as well, that, when you wake up in the middle of the night, it's a reflex thing that you see with any messages.
That's one of the worst things you could do to yourself. Especially if you do it regularly. So if you can't fall asleep, like I know some people have this issue. It's genuine. I'm not saying it that we should just disregard that. Some people wake up in the middle of the night. The first thing they may do is reach for their phones. That's the last thing you should be doing.
To look at the time.
Yes.
And my patient told me that. So how did I look at the time? I said, don't take your phone in the bedroom at all.
Yes. Ideally, yes.
Physical alarm clock.
Yeah.
That's what you should say.
The other thing that I've started realizing is the importance of some supplements when it comes to sleep. So the couple of supplements which I use, which I think are very useful. One is magnesium. Magnesium threonate particularly. I find it very good for my sleep. And one more which I use is myo-inositol. So I use that sparingly. I use it maybe 3 or 4 times in a week. I don't use it every day. But what I find with myo-inositol is it gives me a very good quality of sleep. But more importantly, if I wake up, I'm able to fall asleep very fast.
I see.
So there's no disruption or delay in me going back to sleep.
And that's being evident on your HRV?
Absolutely. So what I do with myo-inositol, it's like a little secret, but I'll tell you. Saturday and Sunday, the days when I go out on the road for a longer ride. So I try not to do any like surgeries on Saturdays. And Saturday morning, I go out with my friends and we go for a long ride, about 100-120 kilometers. So the night before, I take myo-inositol so that I sleep well and I'm well recovered.
I see. Tell us more about the heart rate strap. I'm very interested on it. So you buy that strap?
Yeah. So there's a company, we can talk about the name of the company offline maybe.
Yes.
They have a belief that your heart rate zones, when you get onto a platform like say one of the sports platforms which tests your maximal heart rate and then gives you heart rate zones based on your age and your maximum heart rate.
Correct.
So you have zone 1 to zone 6. But these heart rate zones are static zones. And on days when you're not well recovered, trying to hit those zones may actually be not beneficial to you. So this particular brand uses what is called dynamic zones. So they adjust your heart rate zones based on your recovery. So they test your heart rate variability. Your heart rate variability is a millisecond gap between your 2 heartbeats. So when you measure that for about 2 to 3 minutes in the morning, it tells you how well you've recovered from your previous day. And that tells you whether you're in a well-rested state. So if your heart rate variability is longer, that means your parasympathetic system is more active. that means you're well rested.
Well rested.
And if your heart rate variability is shorter or lower, that means you're more sympathetic. So that means you're not so well rested.
Do you see that in your energy levels as well? Like, let's say that people don't want to do this and then just want to say, okay, I'm very energetic. Is that translated into the HRV?
So that's a good question. So this app asks you a few other questions also. It asks you how many hours you slept, how good was your sleep, how is your soreness, and how's your overall feeling. So it modulates the score based on that. And when you do a workout, it uses that data again to modulate your recovery score. So you wear the heart rate monitor while you're doing your workout, and then it tells you how your workout impacted your recovery, and it recalculates your heart rate zones again. So it may be in some cases where you feel that you're well rested, but your HRV is not good.
Not good.
But then if you're able to hit the zones, it will recalibrate your HRV and say you can do better tomorrow. Or the other way around is also true, where it says you've recovered well, but you're not hitting your
targets.
Yeah.
But in general, for a public health education standpoint, usually what I tell my patients is that, so people say that, I sleep only for 3-4 hours, but I'm completely energetic the next day. That belongs to only few percentage of population where they're completely energetic despite 4 hours of sleep. Majority of them, they feel groggy. They don't want to wake up from the bed. They want to hit the snooze button. When you're hitting the snooze button, which means that you didn't have a good rested sleep. So I am very... Believe it or not, we are also connected through our brain-gut connection. Most of my IBS patients, irritable bowel syndrome patients, I say the biggest thing that you focus on your sleep. Big time. And then I also came across your reel where you said that, don't look at the screen, look at the green on the outside. And can you tell me the pathophysiology behind that?
So it's been shown in some studies where they put people in MRIs, in functional MRI. So another thing about MRI, which we didn't speak about, is you can study brain areas which are active when a patient is inside the MRI.
Which signals, based on the signals?
Which area of the brain is activated. So that is done by blood flow mechanisms. So it's called
functional MRI.
Functional MRI, fMRI.
fMRI.
So you give them, it can either be a resting fMRI where the patient is at rest, so you can map the networks. So, you have the DMN, the salience network, the central attention network, all these important networks which connect eloquent brain areas can be mapped. So, in patients with tumors, for example, we put them in the MRI and we do a resting fMRI, and it shows us the tumor is here and the networks are here in relation to the tumor. So, we can avoid damaging those areas when we operate on the brain.
I see.
But how we know that looking at green is good for the brain is because when people in an fMRI situation was shown various images. So you can do that. You can ask them to look at images, and when you show them green, areas of the brain that calm the person down are activated.
Interesting.
So there is some correlation between nature and our mental state.
Wow. I'm going to tell this to my Irish patient, Irish.
St. Patrick's Day.
St. Patrick's Day is a day where they just go green and go nuts on alcohol.
That's not the kind of green I meant.
So that's a good quote. Don't look at the screen, look at the green. Nice, beautiful, super. Okay, so we talked a lot about sleep. But the most common question that I get is, Doctor, can I use melatonin supplements? It's vaguely rampant in US and also in India. It's over the counter. The biggest problem is it is not regulated. So nobody knows the dosage, nobody knows how much to take. Your take on it from your medical standpoint.
So I think melatonin now is considered as a supplement, and overall the supplement industry is not regulated well.
Yes.
So it's unregulated. And we don't know many of the supplements. There's a problem with many of the supplements. And I think one of the best resources on the internet to use is examine.com, because it gives you very detailed information about each supplement. Of course, from manufacturer to manufacturer, there can be variations in quality. And I believe that there have been studies conducted on commercially available melatonin supplements in the US. And the claimed quantity of melatonin is very different from what is actually measured in them.
Yes.
So there's a wide disparity in the actual content and the mentioned dosage. That's one issue with melatonin supplements. Second issue with melatonin supplements, which I have, is that taking exogenous melatonin, which is from outside, is going to suppress your endogenous melatonin. And over a period of time, your endogenous melatonin is going to get completely suppressed.
Endogenous is the melatonin produced in your body naturally.
In your pineal gland. Yeah, as a relation to your circadian rhythm. Correct. Based on your light and dark cycles. I would not recommend using melatonin except during periods of change in time zone. So, for example, in your case, now when you're trying to get over jet lag, it can be used just for a short duration, just to stabilize your sleep cycle. But I would not recommend using it as a sleep aid, because that is ultimately going to be disruptive to your endogenous melatonin.
One thing I really absolutely hate is that looking into your phone and then taking melatonin 2 milligrams.
Paradoxical activities.
But I do take melatonin whenever there's a transatlantic flight.
Yeah, what's your experience with it?
I started with 1 milligrams. And similar to examine.com, there is a website in US as well where you can check how quality it is.
Correct. Okay.
It is not regulated by FDA anyways, but at least that's the best that you could get in hormone supplements. So I started with 1 milligrams. Didn't do anything.
Yeah.
Didn't anything. So then 2 milligrams. So what I do is I delay my circadian rhythm based on the country's timing a week before.
Correct.
So for example, when I'm coming to India, it's exactly 12 hours.
Yeah.
California is 12 p.m. Noon is midnight over here.
Yeah.
So it's very difficult. So I usually sleep around 10 o'clock, 10 p.m. at night. So I delay that. I delay by 12 p.m., 1 a.m. slowly. And then at the departure of the second flight, I take melatonin. So to a point, in a hope that I can catch up. But most of the times all this...
Yeah, well, there are a couple of things I found. I mean, this is just on a side note of jet lag and all. My son told me about this app called Time Shift.
Time Shift, yes.
So that tells you about how much light exposure to get and when to time your caffeine intake and when to have melatonin and when to try and nap based on where you're traveling.
Yes.
Very good. Yes. Very good app. And the other thing that one can do, of course, is taking melatonin at the bedtime of your destination city.
Correct.
So that's
what I do. So for example, usually the layover is in Europe.
Yeah. Right.
But by that time, it will be bedtime over here. So you take.
So when you get on your second flight, you take your melatonin.
Usually. Or if I'm going that way, Hong Kong, Singapore, so it's based on that as well. The other thing I do is I don't drink any coffee in the flight.
Right.
Of course, it's free alcohol. People stand in line. You don't know that. People stand in line. And
what's your opinion about caffeine and gut health? Do you have an opinion on that?
Yes, of course. Of course. Caffeine is actually good for gut health.
Polyphenols.
Polyphenols. And but the problem is, the studies have been done on black coffee. Okay. What we do is not actually black coffee.
Yeah.
We do milk, we add sugar, and usually turns out to be a filter coffee. So the problem is excess consumption of filter coffee, where you add milk and sugar, adds up to your carb load. Yeah. And that is where the problem is. In fact, there is good data. It shows that large amount of caffeine actually helps in liver disease as well.
Yes, I saw that. In fact, it helps with fatty liver, isn't
fatty
it?
liver.
Sorry. I mean, new name, MAFLD.
Even in, we're talking about preventing liver complications. In the fatty liver, drinking coffee,
preventing
cirrhosis. And,
I'm glad to hear that. Although I don't have any liver issues so far, I'm a big fan of coffee.
Yeah. So again, the problem comes with, as you know, black coffee doesn't have any calories.
Yeah.
Filter coffee has 150 calories. Let's say we're talking about 6 cups. We're talking about like 700, 800 calories.
Yeah, so stick with espresso shots and black coffee.
And then I am a strong believer that not anything after 3 p.m.
Yeah.
Because the half-life of caffeine is like 6 hours. And of course, it interferes with your circadian rhythm, similar to what we talked about.
Correct.
That brings a beautiful segue into how food relates to your sleep. Right? So in gastroenterology practice, I always, when they walk into a problem, when they say have abdominal pain or bloating, I don't ask them, what did you eat? I ask him, when did you eat? When did you eat? Very important. I usually say 3 hours before going to bed, food has to be done. Food has to be done because let's say you eat at 6 p.m. I'm just saying, example. Maybe that's not a good example. Let's say you eat at 8 p.m. for your dinner. That's a very reasonable example. The digestive hormones are active for 2 to 3 hours after. So your actual fasting happens only after like 9, 10, 11 p.m. So you're entering a deep fasted state only at 11 p.m. So let's say you start at 6 p.m., 7, 8, 9 p.m. So you are entering a deep fasted state already. That gives a lot of melatonin surge, the growth hormone surge we talked about. And that is a huge, huge rest to the GI tract. Huge thing, huge factor. So I always tell my patients that if you follow this on a daily basis, you will never see me again. Which is a problem, which might be a very good thing for you. So then promoting sleep, right? Foods promoting sleep is tryptophan.
Yes.
Rich in tryptophan.
Because of serotonin release.
Serotonin release. And we always say that. And always say that when you are eating close to bedtime.
So serotonin and melatonin are actually related compounds. They come from the same precursors.
Same precursors. You deal with SSRI, serotonin a lot.
I don't deal with it, but I have an interest in studying neurochemicals, neuromodulators. And dopamine is my favorite, as you know. Stop scrolling.
So scrolling actually stimulates dopamine in your body.
In your brain.
In your brain.
So it's many people talk about dopamine as a reward chemical. To be honest, dopamine is not really a reward chemical. It's a motivational chemical. It's the chemical that says, I want to get up in the morning and go do my work, do this, achieve this. The consequence of achieving something is the reward. That's why dopamine has got linked with reward. And there is a spike in dopamine, but it's the anticipation of a reward that actually spikes your dopamine more than the reward itself.
Wow.
And from dopamine, there is a concept called reward prediction error, from which some computational neuroscience has come about.
Tell me more.
I'm not very sure about what exactly has come about from that, but it's something called reward prediction error. So when you are expecting a dopamine surge or a reward and you don't get it, and there's a crash in your dopamine levels, that changes the circuitry in your brain. And then you go into the opposite side of, dopamine withdrawal. And that modeling has been used for machine learning to teach machines how to learn from behaviors.
Wow.
So it's the same model which has been applied in machine learning. It's very interesting, actually. So I'm sure somebody in the audience from a machine learning background will be able to say more about this, but this is what my understanding of it is.
Wow. The more you scroll, you are waiting for that dopamine to hit. Until then, you keep scrolling.
So what happens is when you look at one reel, then you got your dopamine reward from that reel. You scroll to the next one. But the next one doesn't seem as interesting. And then you keep scrolling, waiting and waiting and waiting and waiting for that
next hit,
the next dopamine reward. But it doesn't come. That is because you have done too much of scrolling and your dopamine system is exhausted now. So you've released, dopamine is actually stored in little balloons in your nerve terminals. When you release it, the dopamine has to be taken back and resynthesized and then released again. But when you're exhausting all your dopamine, you're releasing too much of it, there's no dopamine left. And the receptors which are after that neuron, the postsynaptic receptors, are all saturated because you've released a lot of dopamine. The receptors are all blocked now. And your receptors are also desensitized because there's so much of dopamine. What happens similarly in insulin resistance, right? Where your insulin receptors are desensitized. Your dopamine receptors are desensitized. So you need a lot more dopamine to get the same feeling of reward.
Wow.
But your dopamine is exhausted. So you're really in a very bad state and you sink into the reverse, which is depression.
So it's basically dopamine resistance.
Yes. To some extent, we
call
it as dopamine resistance.
Similar to that.
Happening at a synaptic
levels. So anticipating reward, and then the more you do, the longer it gets.
So it's the system gets sort of exhausted, immune. to reward, and nothing feels pleasurable anymore. So you get into this state where you're depressed. You don't find happiness, joy, pleasure in, small things also. Looking at Instagram or any social media, TikTok, whatever it may be, doesn't give you the same feeling of reward that you get. But if you ration your social media exposure, then you're allowing your system to reboot, to build up some more dopamine, your receptors to get desensitized. Then when you go and do it occasionally for a fixed period of time in a day, where you're rationing it out, then it feels pleasurable still. So one has to be careful about how much of exposure you get to these social media apps.
One thing I've created in my routine is a self-discipline, which was very difficult initially, that being a full-time clinician and being active in social media is a big stressful factor to start with. But I like both. So then what I did was I created a timer.
Yeah.
No matter what I do, once I click YouTube or Insta, whatever it is, 10-15 minutes, that's it. And once that timer goes off, I make sure that I don't hit the snooze button. That really helped me a lot. And I think you also talked about a reminder that comes on the phone, correct?
Yeah. You can, and on your smartphone now, you can program how many minutes of social media you're allowed per day, and it gives you a reminder.
Yeah. And actually it locks the app.
Yeah, you can lock the app also.
And I tell that only your spouse should know the password. Not you.
So I check my social media twice a day. Once after I finished my morning routine, I just check on Instagram to see if anyone has any questions that I need to answer. Because some people may have some questions which are, which need to be answered and clarified. And then at the end of the day, after I finish my work, I check once. So barely 5 minutes each time. And I usually don't scroll that much on social media, although I have advised everyone to stop scrolling. They all say, if you ask us to stop scrolling, how will we come across your videos?
Your videos are okay. No, you scroll until the dopamine hits is okay. So we're going out of topic, but I think it's a good thing to talk as a physician. I have been in this social media for the last 2 years very actively, where this is not my full-time job, right? So my full-time job is my clinical profession.
Yes.
So I'm not dependent on financial return on YouTube at all. In fact, most of the income goes to the charity. Similar to you, I also have a charity in Madurai. So for me, the pressure is not there. I'm doing it for fun.
Yeah.
I like it. I'm passionate about it. I'm doing it. And the reward that I get is, when somebody comes and tells me that, hey, I lost weight because of you. That's your dopamine hit right there. Right there. But I'm really concerned about these young people who are doing social media full time.
Yeah.
Where every post is connected to financial revenue. And they have to analyze each and everything. Okay, what goes well, what doesn't go well, and all those things. And I'm telling you, I was in a YouTube social media conference in Tamil Nadu.
Okay.
Where popular YouTubers in Tamil Nadu met. Okay. And a lot of young people. I consider myself young in that group. I'm 40, but they were 20 to 25, 30.
Your biological age is about 20.
But the way that they handle social media, I was scared. Every minute they were, taking stories, taking this, always conscious about, do what is the next and everything. So I'm not talking about only social media. The thing is that the way I'm really scared about younger generation and social media, really. Because the way it is portrayed, way it is being interpreted, especially when people are... One guy actually looked at me and then said that, I want to be like you. I said, oh, good, perfect. Gastroenterologist is good. No, YouTuber.
But gastroenterology is also all about tubes only.
Tubes, exactly. So I really feel that there's a lot of pressure. In your neurology standpoint, is that what depression, anxiety is?
Yes, it is definitely linked to what we are seeing in today's day and age. Adolescent mental health issues.
Ah.
And the increase in mental health issues amongst this generation.
Do you think social media is tied down to anxiety and depression and adults?
Absolutely. I strongly believe it has changed the way human beings interact with each other. If you notice, now personal interactions are becoming less common. People are becoming more isolated. And a lot of the interaction is happening on social media platforms where you are not emoting any feelings. You can say some pretty nasty things on social media without having to see the repercussions of it on someone's face or someone's behavior. I think that is really affecting mental health very adversely.
As a parent, should we be worried about it?
Absolutely. I think we have to start encouraging our children to a similar kind of childhood that we had, where they go out into the world and play on the streets and meet their friends and, do regular human things rather than interacting on social media with strangers and with people whom you're never going to come into contact with. And then getting this complex of I'm inferior, my post is not as good, it didn't get as many likes as yours, whatever. That's really affecting the mental health of students and children these days.
I'll tell you a story. There was a talk show that I did in Florida. Okay, I was going to my friend's house. My friend was at work, and his wife. Let me take that back. My friend was supposed to come to the house, and he said, why don't you walk in? My daughter and my son is there. Okay, daughter is around 18, 19 years old. And the son is around 10, 11 years old. So I walk in, he gave me the code. So I enter the code, I open the door. As soon as I stepped into the house, one sound, it says, I'm going to shoot you. Stop right there. I'm going to shoot you. I was like, what am I doing? This 10-year-old is playing video game in the room and he's shouting into the computer. So I think that limiting screen time is one of the very critical things. Very important.
And also giving our children access to smartphones when they're not ready for it. I think that has to be looked at very carefully. Giving them any kind of device which is unmonitored, where time is not rationed, needs to be really reconsidered. I think there are people in the US who are talking about this at a public level.
Yes.
About the impact of mental health, and it's becoming a big problem. If you are having someone who's diagnosed with clinical depression at the age of 18, it's a chronic illness. Depression is not something to be taken lightly, or whatever mental illness is not to be taken lightly. And I think the anxiety levels amongst teenagers and youngsters is increasing because of social media. So it's very sad to see, and these are problems that are going to have serious health repercussions when these people turn, their 30s and 40s.
The foundation is being disturbed.
Very much.
It's being disturbed.
Very much.
So I always say, maybe we should have this tagline, don't look at the screen, look at the green, for every iPad or iPhone.
Stop scrolling.
Right.
Turn away from your screen, look at green.
So we were talking about the diet and tryptophan causing sleep.
Yeah.
We were talking about the lifestyle changes in terms of diet, how we can promote sleep as well. So coming back to it, I have read in multiple literature that our brain loves fatty acids.
Yeah.
Loves fats. They actually do better on ketones.
Yes.
And when does ketones form? When there are no carbs.
Yes.
So when body has exhausted the carbs,
yeah,
your body is forced to take energy from the fat globules.
Yes.
And once you keep on doing that in extended fasting and all those things, then the fat globules gets deposited and converted into fatty acids. And the byproduct is ketones. And you can either measure it in the urine or the breath.
Or even the blood.
Even the blood.
Yeah.
And actually people think that when you're fasting, you will become very dull and you will not be able to focus. But actually the focus increases.
Is true. Yes.
Focus increases because brain loves ketones.
Yes.
Your take on ketone for brain health, and more importantly, is ketogenic diet recommended for improving brain health?
So my opinion about diets is I think everybody should figure out their own best diet. Ketogenic diet can be a good diet or can be a bad diet. If you are going to eat highly processed foods, it can still be ketogenic. And if you're going to eat natural whole foods, it can also be ketogenic.
Correct.
So you can have a healthy ketogenic diet, which is probably beneficial. But I also think it's important to realize what kind of lifestyle you're leading and adapt your diet according to that. So for example, if you are doing a lot of cardiac exercise and you're very much on your feet, I don't know whether a ketogenic diet is a sustainable diet in the long run. So your diet needs to be healthy. So it should be whole food, preferably have some amount of plant-based component, enough fiber. It should be sustainable. It should be something that you can sustain for the rest of your life and gives you good health at the same time. It's pointless getting into a diet which is unsustainable because that's a failure. That's a recipe for
disaster.
Failure. So ketogenic diet is brain healthy. It's used in a lot of children who have refractory epilepsy, and it's been shown to be beneficial. But it's difficult to achieve real ketosis in the real world because invariably some carbohydrates will sneak in somewhere. To get a true ketosis is very difficult.
Very difficult. My take on that is, one thing we can learn from this literature is brain ketones is good for brain. But practically speaking, an Indian community sustaining on a ketogenic diet is very difficult. It's very difficult. And there are studies actually say long-term ketogenic diet has some cardiovascular deleterious effect as well.
Okay.
So I usually say that any diet similar to you, any diet which is sustainable is the way to go. But one thing we can take out from this literature is that, as you said, refractory epilepsy, where they have seizures. And when you don't feed carbs to the brain, the brain actually does well on ketones, where the seizure disorder goes down.
Yes.
How we can translate that is, hey, no, you don't have to be on keto. How about limiting your carbohydrate intake?
Yes. Always a good idea.
Always a good idea. On any specialty, as we talked about. On any specialty. In my field, in gastroenterology, we have seen that the more carbohydrates that you take. Okay, so I did this small research within my limits, where I have a lot of South Indian patients. I'm just curious to see how much amount of carbs that they're taking, even on a healthy diet.
Yeah.
Not even unhealthy. They're not eating pizza, pats, nothing. They're just eating regular channa, rajma, vegetarian,
home cooked food. Yeah.
Home cooked food, good carbs. Home cooked carbs, normal average of that 100 patients is 300 grams per day.
That's insane.
The 300 grams per day. The reason is, South Indian community, as you know, we have like sambar rice, rasam rice, and then curd rice. They don't know the amount of rice involved. It's not that rice is bad, but the amount is the key. So what we, as an awareness thing, what we did was, okay, so we asked them to document on a daily basis. We didn't ask them to change anything. The next visit, we showed them, look at this is 300 grams. And we showed this study as well. We said, your brain works better on low carb. So we said that, okay, instead of doing, you are doing 300 carbs. Keto is less than 20. Can we meet somewhere in between at 150? What do you say? And then they were like, okay, I'll do for 250.
I read somewhere recently that you don't actually require more than about 140 grams of carbohydrates per day.
Yes.
For a normally active person.
130 to 140.
But most people consume way more than that.
Way more than that.
And most people are not even aware. And this high carbohydrate consumption is what is driving most of the metabolic disease we see today.
Of course.
Be it fatty liver, diabetes, obesity, neurodegeneration, high blood pressure, you name it. It's all coming from this.
Wonderful. That is where my research on gut microbiome being grown in a good fashion on a low carb, all those things coming in. And most important thing, you might be interested in this, where we are researching what chemical can be produced by the gut bacteria at the intestinal level and that can influence the NTS, nucleus tractus solitarius, to secrete the same amount of chemical at the brain level.
I see.
So, for example, there was a study that they said that, okay, you can actually produce serotonin at the intestinal level by the bacteria, what you want. and make sure that it has the same amount of efficacy as an SSRI, as a medication that gives you the same amount of serotonin levels.
Well, actually, serotonin as a neurochemical is more dominant in the gut than in the brain.
Correct.
And it's a very interesting link that serotonin is predominant more in the gut, but has such a significant effect on brain.
On the brain
function. And how we can find a link between the gut and the brain with the gut bacteria is really fascinating. And I hope we get some more clarity on that in the years to come.
Of course. Right now, we don't have clinical evidence that much. So I have a very strong feeling that based on whatever I know and whatever research I'm involved in, if you take care of your gut bacteria and make sure that you have a significant proportion of good gut bacteria compared to your bad gut, we can completely eliminate depression. This is a strong statement, but I strongly believe in it. Where 5-10 years from now, people will say that, hey, you might have to eat this food to increase your serotonin so that you can counteract your depression effects.
I think you're right. I think a diet has a very important role to play in mental health. The other thing that I was reading about recently is butyrate.
Butyrate, yes.
Short chain fatty acid, which is secreted from the gut bacteria, which has a very beneficial effect on the brain. And it crosses the blood-brain barrier and influences brain environment.
Decision making.
Yes.
Decision making.
Yeah.
And exercise increases butyrate regardless of the diet. So we had
one more big thumbs up for exercise.
We had two groups. One group was like healthy diet, everything. And the other one was ultra processed food and all those things. Exercise, same regimen. So both had increase in butyrate.
So that means you can outrun a bad diet.
No. The amount of butyrate thing was significantly blunted, but there was still increase. There was a beauty. There was a beauty of that.
So the saying is that you cannot outrun a bad diet, but
you can never.
Yeah, probably not.
You can never outrun a diet. That's the other problem. Where people think that, you must have seen an Indian get-togethers where, you can eat one day today. Tomorrow you run 5 kilometers.
Yeah.
And tomorrow will never happen. Super. It has been wonderful talking to you.
The pleasure has been all mine. It's so nice to sit across with a fellow medical professional who's in social media.
Right.
And brainstorm on some very interesting ideas and thoughts.
Of course. And what you're doing is wonderful. This is what people need. And keep doing the good work. And primary prevention is the way to go. Thank you so much for your time.
Thank you so much.
Thank you. That was a wonderful episode with Dr. Arvind Bhateja, popularly called Doc AB. I learned a lot. I'm sure you enjoyed as well. Thank you so much for your continued support. Please consider subscribing to our channel so that we know that we are putting out some quality work. And we are also bringing more qualified experts in this field to share about more practical topics so that you can implement that in your daily lifestyle. We have also opened up 2 new channels. One is Gut Feeling with Dr. Pal Clips and Gut Feeling with Dr. Pal Shorts. We have put both the links in the description. Please consider subscribing to them as well. We have also released our podcast in Spotify audio platform. If you want to listen to audio during your car driving, that is available as well. Again, thank you so much for all your continued support from the bottom of my heart. My job is to put out quality content for you.